Hello everyone, my name is Evan Kim, and today I'll be presenting on my research on adolescent depressive symptoms and physical activity in relation to school bullying and obesity. I'm a rising senior at Seoul International School, and here are my extracurricular activities. I'm part of the school basketball team for a consecutive 3 years, which shows my natural interest in sports. Though I enjoy playing sports, I wasn't necessarily good from the start. However, by participating in basketball and other sports, I spent a lot of my time around other people. In 2019, when I went to LA, I visited the Children's Hospital at Los Angeles, where I had the chance to oversee the work of Dr. Lorraine Kelly Kwan, a general pediatric surgeon. Finally, as president of Liberty in North Korea, or LINK, I focused on helping North Korean refugees, especially adolescents, through fundraisers and fun activities to boost their mental and physical health, especially during the pandemic. Finally, I plan on continuing my research in psychology and physical activity using empirical data. Without further ado, let's start off with the presentation. Depression is one of the most common psychiatric symptoms and disorders occurring right now in adolescents. Depressive symptoms can result in severe impairments that interfere or limit one's ability to carry out essential life functions and activities, and adolescents are more likely to demonstrate suicidal ideations as a result. According to data from the 2017 National Survey on Drug Use and Health, in 2007, adolescents who experienced at least one major depressive episode the past year were about 8% and 29% reported feeling nervous or tense. However, in 2017, about 13% reported depressive episodes and 45% reporting feeling nervous or tense, respectively. From 2007 to 2017, the number of adolescents reporting depressive episodes increased by 59% over the past decade. A substantial literature provides an empirical rationale for the physical and psychosocial benefits of regular physical activity among adolescents. First, youth who engage in regular physical activity, such as PE classes or team sports, are less likely to be overweight and report better psychological well-being, including lower levels of depressive symptoms, and physical activity also provides an opportunity for social interactions, mastery in the physical domain, improvements in self-perception and appearance, and independence. Physical activity has been shown to be associated with improved physical and mental well-being and can reduce the risk of depressive symptoms among adolescents. While the underlying mechanisms thought to mediate the relationship have not been well established, my research investigates the association between physical activity and depressive symptoms and whether this could be explained by biological and social factors, obesity and bullying. My research is a cross-sectional analysis of data drawn from the 2019 Youth Risk Behavior Surveillance System, YRBSS survey, including a nationally representative sample of US high school students with a sample size of 13,677 participants. This is the conceptual model that my research is focused on. There are multiple studies already displaying the link between physical activity and depressive symptoms as told earlier. However, I want to look into this deeper, so I wondered about what other factors can have a possible association with the two. So I figured both obesity and school bullying, as physical activity can lower obesity and make them healthier, lowering the likelihood of being obese, resulting in lowering depressive symptoms. Also, if they participate in sports a lot, then their social relationships would get better among the students, since they would have a lot of time to communicate and socialize with each other. The YRBSS is the largest public health surveillance system in the US, monitoring a broad range of health-related behaviors among high school students and including a nationally representative sample of US high school students. YRBSS procedures were approved by the CDC Institutional Review Board and detailed in prior studies as well. Participants in this study were 13,677 students in grades 9 to 12 who completed the most recent study. With this in mind, here are different measures that I coded using regression models in order to synthesize and assess the data. To assess a common depressive symptom, participants responded to a single question regarding their thoughts and feelings. During the past 12 months, Did you ever feel sad or hopeless almost every day for 2 weeks or more in a row that you stopped doing daily activities? The responses were coded as shown. The physical activity score was assessed by 3 categories. First, the weekly frequency of physical activity was assessed with, during the past 7 days, on how many days were you physically active for a total of at least 60 minutes per day. Then, students reported the frequency of their physical activity education classes at school using the item, in an average week when you're in school, on how many days you attend physical education classes. And finally, the number of sports, teams, or clubs that the students are engaged in. During the past 12 months, how many sports teams did you play on? These 3 items were created based on the YRBSS guidelines correctly, classifying students as meeting the recommended level of physical activities, and were summed to create the reliable and valid scale of physical activity, covering various activities related to physical health. Weight was measured with shoes to the nearest quarter pound using a physician balance scale, and height was measured to nearest quarter inch using a portable physician scale stadiometer. The body mass index, or BMI, was calculated as weight in kilometers and height in meters squared. Then, age, gender, and BMI were used to classify participants as obese when the BMI percentile was at or above 95% for BMI by age or gender. Finally, participants reported if they were bullied at school in the past 12 months, and responses were coded the same, like depressive symptoms, either with a yes or no. First, descriptive results for each study variable were evaluated. The YRBSS employs a complex sampling scheme requiring the consideration of sampling rates, unweighted frequency, and read percentages as presented in Table 1. The data here are the raw statistics from the study. With this data, I tested a series of binary logistic regression models to examine associations among the key study variables, including physical activity, obesity, school bullying, and depressive symptoms, performed using the IBM SPSS software version 27. Here is the final diagram that I made that summarizes the findings. As shown, physical activity was negatively associated with depressive symptoms, as previously studied and found by previous studies. This means that more physical activity participation means that there's a lower likelihood of developing depressive symptoms. A series of regression models have been tested and found that physical activity is positively associated with a reduced risk of obesity, and obesity shows negative association with depressive symptoms, respectively. Being physically active improves one's muscle strength, physical health, and mental well-being, further showing the association between the two. Also, physical activity is positively associated with school bullying, as they have a lot more time to socialize and make friends, and thus lowering the chances of developing depressive symptoms. The relationship between physical activity and depressive symptoms can be explained due to the reduced risk of obesity and school bullying. The following are the conclusions that I was able to make. First, adolescents who participated in more frequent physical activities or classes showed lower likelihoods of developing depressive symptoms. Engagement in frequent physical activities, programs, and teams and club sports were negatively associated with lower risk for being obese and bullied in school. Explain the association between the physical activity and depressive symptoms. Next, being involved in physical activity facilitates social development, positive self-perception, and acceptance by providing opportunities to feel accepted by peers and promoting positive peer relations. Finally, the benefits of youth physical activity can reduce the risk of school bullying, a proximal influence of depressive symptoms. Defining of pathways linking the key factors can increase our overall understanding of the biological and psychosocial benefits of physical activity in adolescence. By improving our understanding of how physical activity can reduce the risk of depressive symptoms in adolescents may assist in the design of interventions to optimize the possible impact of the mechanisms that confer protection against youth depressive symptoms. And finally, I wish to thank everyone for listening to my presentation. First, I want to thank Mr. Monroe, Mr. Timothy Monroe, for discussing about the topic and giving me priceless insight and ideas for the research. And finally, the Mindcare Institute of Korea, where I volunteer for social skills groups with other international school adolescents. And if you have any questions, feel free to contact me through my email as shown here and my socials.